I'm an emergency medicine doctor, and these are 5 of the most common signs of cancer that I see ignored, usually until it's too late. The key to cancer survivability is prevention and early detection. So when you ignore these symptoms, it results in a delay in care and can be detrimental to your health. So if you develop any of these symptoms that I'm going to speak about, please call your primary care provider right away to be evaluated. Coming in at number 1, we have painless hematuria or painless blood in the urine. This is often a sign of urothelial carcinoma or bladder cancer and is especially true in patients who have a history of smoking. So if you're a smoker or a prior smoker, and you start to notice blood in your urine, especially if there's no pain involved, you need to call your primary care provider. Painful blood in the urine is often a sign of something different. It can be things such as a urinary tract infection or a kidney stone, so the painless portion is key here. Number 2, we have painless jaundice or painless yellowing of the skin. This is often a sign of pancreatic cancer, and unfortunately, pancreatic cancer has one of the highest mortality rates among all the cancers. So early detection is really important here. I see this one ignored because, again, it's painless, but also it starts really subtle. Maybe a little bit of yellowing of the eye, a little bit of yellowing of the skin. You kind of blow it off. You think that it'll go away, but it's not gonna. Painless jaundice, painless yellowing of the skin is very, very important that you see your primary care provider be evaluated. Number 3 is back pain that gets worse at night. And I'm not talking about somebody with chronic back pain. It gets worse when you're laying in bed, or somebody who recently injured themselves. I'm talking about it's atraumatic back pain that gets significantly worse at night, and oftentimes it'll wake you up in the middle of the night. This is often a sign of metastatic disease or cancer that spreads to the spinal bones, or even hematological cancers such as multiple myeloma or leukemia. Number 4 is probably significant weight loss, especially when you're not trying to lose weight. Weight loss in a really short period of time. And that's because cancers or tumors themselves kind of suck up all of the nutrients that you take in, and the rest of your body has nothing left to work with. So you lose a dramatic amount of weight really quickly. You also feel really weak with it. Last but not least, number 5, testicular masses or breast masses. I see this ignored really often in young people, and that's because they're a little more sensitive about these areas and they don't want to be seen, they won't want to be evaluated, but it's really important that you do because these are often a sign of testicular cancer or breast cancer, and these are really treatable cancers, especially if they're found early. I know a lot of people don't like going to the doctor, whether that be for personal reasons, financial reasons, or you're just scared of the outcome. But it's really important if you develop any of these symptoms that you give your primary care provider a call right away because, again, early prevention, early treatment is the key to survivability here. If you'd like to hear more about emergency medicine care or just healthcare in general, give me a like, follow. I'd really appreciate it. It helps the channel. I'm just starting out. I'm trying to get a good following. So until next time.